everyone knows a bad headache can really throw a wrench in your day. But how do you know if what you're suffering from is actually a migraine? The difference isn't just in the severity. A migraine is actually a neurological condition that can require more specialized treatment. So Dr. Cynthia Armand is here with me in Studio 57 to discuss the symptoms and the remedies. She's a neurologist and a headache specialist at Montefiore Medical Center in the Bronx. Thanks so much for joining us. We were just talking in the break, and I was saying sometimes I get these things that feel like headaches without the pain. My eyes are bothering me. It looks like my vision feels a little askew. And you said that could be a migraine.
Sounds like a migraine.
Okay,
right.
So then what is the difference between a sort of a bad headache and a migraine?
So a headache is really this catch-all umbrella term for pain in the head, right? It may not necessarily be a brain disease. It may be something that's happening in the body that could be manifesting as a headache. But a migraine is exactly what you said. It's a neurologic condition. It's a chronic brain disease. And really, it's characterized by much more than just head pain. So the hallmarks, people can have pain on one side of the head, throbbing, moderate to severe severity, to the point where they can't function. They're unable to be productive members of society. And there could be nausea, vomiting, light, sound sensitivity. They really want to be in a dark, quiet room away from other individuals.
Right.
And they can have other symptoms that we call aura, that can be visual symptoms that just feel like they come out of nowhere. They can have numbness on one side, weakness on one side. So it's exactly what you were saying. It's much more than just head pain.
That's fascinating. So I know what gives me a headache. Usually red wine. Like, you know your triggers, right?
That's a common culprit.
Right, but migraines, I think, are different. What are some of the triggers for migraines?
So really, there's a misconception about triggers. So triggers do not cause a migraine. They simply lower the threshold for someone who already has migraine disease, right? So, for example, triggers can be different in others, right? You said yours is red wine.
Yeah.
My trigger is lack of sleep, right? So it can be sleep-wake changes, food ingredients, not eating on time, and actually weather changes can be a trigger for many individuals as well. Barometric pressure drops, bam, headaches coming on. A lot of my patients tell me, I know when it's gonna rain. Because the symptoms just start, right?
Yeah. Oh, that's so fascinating. Okay, so then the question is, what do you do? I mean, sometimes, you can't just bury yourself in a dark room. You're at work. So how do you address this?
Right. So really, I tell my patients that the migraine brain loves consistency. You really want to know and learn more about your body. And the best way to do that is to keep a diary. So I tell my patients, jot down when you have a headache and what you think may have been surrounding that the circumstance that could have led to the headache coming on, to the migraine coming on, right? And then when you have that information, think to yourself, okay, I think I had a migraine when I had 3 hours of sleep. Maybe having 5 to 6 more may be better for me.
Right.
And I can work on that and see what happens. And what happens if the 3 hours comes again. And the best part is you don't have to do that alone. You can speak to your healthcare provider, start with a primary care physician, a neurologist, or a headache specialist, and they'll work together with you in order to determine that.
I feel like there should be an app for that. There might be. I don't know.
There are apps. Absolutely.
Perfect. Dr. Cynthia Armand, thank you so much.
Thanks for having me.
This program is brought to you in part by Ubrelvy.